Everybody on. Want to welcome everybody, and I'll continue to welcome people as they populate our screen and join the meeting. So always so nice to see you all, or hear you all, or know that you're there. So this is the October 6th meeting of PHAB. I'm hoping that we will have time in the agenda. It's not as packed as we usually have, but we have three wonderful guests or our updates from our public health and primary health staff members. And we will also have a presentation from our new Director of Health Services, Dr. Siobhan Kothari, who I think you'll just be thrilled about hearing what's going on and the changes she's making. So I'll give it another couple of minutes before going into introductions. I thought it would be a very good opportunity for us to do some introductions since we have new members. And some of even our more recent members, not our new members, haven't had a chance to get to know the rest of the board. Usually when we were in person, we would go around the room and just have brief introductions, but we haven't done that for a while. So we'll just have a few more people join and start to introduce each other or ourselves to our fellow members and the public. Yeah, Jofel, congratulations. I see you joined. Jofel has been appointed to the Planning Commission as a planning commissioner, I believe, for the county. That's a wonderful appointment. Very, very prestigious. All right. Make sure we have quorum. 1, 2. Yeah, we do. Okay. All right, one more minute. Sure is missing. All right, well, I'll start. I think we're pretty good here. So I'm Farla Kaufman. I'm an epidemiologist. I do a lot of environmental epidemiology, actually. And I work for the Office of Environmental Health Hazard Assessment in the California Environmental Protection Agency. And I also have a position at the University of California, Davis, in the Department of Public Health Sciences. That all of this keeps me pretty busy between PHAB and that. And I have a lot of special interests, many. One thing that I was very interested in when I joined the board, or before I joined the board and I was looking at the board, is the high rates of STDs in our county. So that's still on my agenda, but some things took priority. We've had an interesting roller coaster last couple of years. So of course, COVID is high on everybody's priority list and necessitated a lot of effort from everybody and attention. But there are also other issues, the mental health issue in this county, as well as everywhere else, I might say, but also the suicide prevention efforts and correctional health has been a big one. So that's where I am. All right, so Steve, you want to go next? Because you're next on my board, my screen.
Maybe if I unmuted myself, I'm Steve Heath. I have been a member of the board now for about 4 years. I'm a nonprofit executive, most recently with Central California Hemophilia Foundation. And I'm also a member on behalf of this group with the Medi-Cal Dental Advisory Committee.
Thank you. It's Tina, you're on my screen next.
Hi, everyone. I'm Tina Slee, although you probably see me on the screen as Christina. I like to go by Tina. I am the Director of Quality and Patient Safety at UC Davis Medical Center. I've been in my director role for about 7 years, although I've been at UC Davis 24. And I've done a lot of different work. Probably the longest period of time that I've spent at UC Davis has been with a research unit called the Center for Healthcare Services and Research, or Healthcare Policy and Research. That kind of reflects my own love of public health. I have a MPH from Michigan from many, many years ago in health policy. So this is my way of kind of connecting to that particular professional love, which I don't get to enjoy so much in my day-to-day job.
Thank you. Any special interests for us on PHAB?
Oh, yeah. So I failed to discuss that. I'm very interested in maternal and child health and health disparities. So, and it may.
Okay. All right. I just want to warn you all for a moment. Tina froze on my screen because I am traveling. I'm in Canada and I'm somewhere where the internet is not as high speed as other places. So if I seem to be blitzing out, that's the problem. And if it gets really bad, Tina has graciously consented to run the rest of the meeting. So thank you. Phil, you're next.
Hi, everybody. My name is Phil Summers. I am, I've been on PHAB for about 4 or so years also. I am an emergency doctor and an addiction doctor here mostly in Sacramento. I also have my MPH degree and have done various research and kind of worked in this space doing advocacy work as well. My special interests are mainly around substance use disorders and health disparities around that, harm reduction and syringe access, overdose prevention, and also kind of the health disparities that exist for people who are incarcerated and how we can improve those. So.
Thank you very much. Ashley, you're the next tile.
Hi, good afternoon, everyone. I am Dr. Ashley Ridley Sterling. I am a pharmacist. I work for CVS Health. I've been with this company now for 11 years, but I find my greatest reward is when I get to work with the community. So through CVS, I've been able to educate high school students about preventing them from getting on to opioid medication. So that's a passion of mine. I'm originally from South Florida and the opioid epidemic was pretty bad there. And so I just wanted to play a role in ensuring that we could prevent that through an educational standpoint. I would say more personally, I'm really hoping to get more involved in, I would say, trauma-induced mental health in hopes to help, I guess, prevent some of the effects of these, of how I would say racism is impacting the Black community. And I've just dived into yoga, meditation, and things of that sort. And I hope to be an advocate of using these systems to help heal my community. So those are my special interests. Okay. Thank you, guys.
Thank you very much. Who's next? Chase. You have to unmute.
Yes.
Yeah.
Thank
Hi.
you. My name is Chase. I am currently an assistant nurse manager over at UC Davis. I have been at UC Davis for about 5 years now. I recently transitioned over to my current position about 1.5 years ago, where I oversee patient placement. It's called bed control, taking in patients from the emergency room, from clinics, direct admissions, and the transfer center. I also supervise the mental health workers and am in very close connection with discharge planning for our mental health patients that we have at UC Davis. So I'm very involved in their planning and discharge planning. I'm also a clinical professor at the University of San Francisco at our Sacramento branch campus, where I teach at the VA Mather, which is where I'm at right now. I'm enjoying the sun outside on the call. I have an interest in mental health and how our Sacramento County can improve. And I look forward to contributing where I can.
Thank you very much. Okay, let's see, Jeffel. Are you there? Let me just check. I don't know if you're still muted. Jeffel, are you with us? Okay, I'll come back to you. Maybe you'll join us shortly. Libby.
Sure, thanks, Farla. So my name is Libby Abbott. I'm a relatively new member of PHAB. I joined earlier this year. I was born and raised in Sacramento and kind of recently returned. So part of joining PHAB was really part of my effort to understand how I contribute to my home community, but also just to learn about health systems here. My background is in global health. So I've spent the last 15, 20 years kind of working abroad, primarily on health systems, predominantly in Sub-Saharan Africa and South Asia. So while I understand a lot about how to make things move in those contexts, I am very new to learning how to make things move locally. So this has been a really great education for me. I've been for 9 years at an organization called the Clinton Health Access Initiative, and we work predominantly with governments in low and middle income countries. I lead our health workforce development team, which means working with governments to help them figure out how to solve their health workforce problems. So very much a systems orientation. And I'm most interested in sort of issues related to health equity and access broadly. And I think that can look like a number of things here. Right now, very involved in the Correctional Health Committee, which has also been a big education for me, but is something that feels like a really important issue. And I'm very excited to have folks who are teaching me about that and working with us to figure out how to make good recommendations to the board.
Wonderful. Thank you so much. Barbie, are you available?
I am driving right now, so I will keep it brief. I'm Barbie Law. I've been on PHAB representing the public for, I think, 4 or 5 years now. I have a background in emergency medical services. My full-time job, I'm the emergency medical services chief for Sacramento Metropolitan Fire. Actually, one of our previous PHAB members was the one that really got me interested in getting involved with community efforts related to public health. That was Paula Green. And so, yeah, that's me.
Thank you very much. Sonal.
Hi, everyone. Hi, Farla. My name is Sonal Patel. I have been a part of PHAB, I think, for about a year and a half, maybe 2 years almost. I think it was right before COVID that I joined. My background is in public health. I have a master's in public health and started my career at the State Department of Public Health. I now work for the State Department of Finance, working on the administration or governor's fiscal policy in the world of health and human services. So I worked on public health policy, behavioral health policy, and I now work on public policy related to foster care. And my kind of passion is behavioral health as well as the responsible allocation of resources. Personally, I feel like public health never gets enough money. And I think that there needs to be ways that we are better and evaluate how we use our resources so that we're using them in the most effective ways with the little pot of funding that we do, that we are able to get. So that's kind of where I am and how I ended up at finance.
Thank you very much. And let's see if Joe Phil has joined us again. I know he whips out, he's so busy. Sometimes he tries to get off and answer some calls, but okay. Joe Phil works with the legislature for Caltrans, And as I said, he's now appointed to the Planning Commission for the county. And maybe he'll come back on after, and he's been around for a while, a number of years. Anyway, wonderful to have you all as members. So we know a little bit more about each other, we hope. So now I want to move on to the approval of the minutes, just an administrative task. So we had 2 meetings in September, our regular PHAB meeting on the 1st and a special meeting on the 9th, so that we could send our priority 5 lists, the 5 components of our priority list to the Board of Supervisors to help inform them of their priorities for the coming fiscal year. So let's take the first meeting. Were there any edits or changes, corrections to the meeting minutes? Hearing none. Is there a motion to accept the minutes?
So moved, Steve Heath.
I can always count on you, Steve. Thank you. Motion.
It's one of my real talents in this world.
No, it's just facilitates us moving faster. It's wonderful. Thank you. So we can vote on the minutes. And we do that by entering our vote in the chat, yay or nay. So I will just say yay to accept. All right, wonderful. Okay, 1, 2. Wonderful. Okay. Thank you. Minutes approved. And for the September 9th meeting, is there a motion or any corrections to the minutes for that meeting? Okay.
Yeah, I don't want to hog the spotlight, but I'll move approval.
Okay.
Steve.
Thank you. Okay. Motion to approve. Could you type into the chat your yay or nay for that meeting? Felt wrong, but that's okay. Let's see. Good. I haven't seen many come in. Or are we on to the other ones? Wait a second. 1, 2, 4, 6. Okay, meeting minutes for September 9th approved. Jofel, are you with us? I see you voting. So if you'll unmute, and we were just doing introductions and just mentioning what we do, our special interests on PHAB. Are you with us? No. No. Okay. All right. Next time. All right, on to our next agenda item. Thank you for all of that. Actually, I just want to give you an update. We still have, I think, 3 vacancies on our board, and we have 1 application that is pending currently. So we may have filled 1 of those vacancies, but that's where we stand currently. And I just want to mention for the meetings that we hold, I know there's an agenda item at the end that says public comment, and there's 5 minutes allotted for that. But in the recent past, our meetings have allowed for public comment during the meeting, as long as it doesn't divert us too much off the agenda. So I would invite the public to either chat, which might be preferable during conversation, or if they have a comment, or to speak up and but keep it brief. So I invite that. So Let me see where we stand. I think we're okay, a little ahead of schedule, but that's always not a bad thing. Let me see where we are. All right. All right, so Liz, our fantastic staff person, has asked to please use the raise hand feature or chat to let us know so that we can know if you have a comment throughout the meeting. So that's a very good suggestion how to do this. I appreciate that. All right. So Olivia, do you think that you might step in for the next 10 minutes and give us an update? Hi.
Hi. Sorry, trying to multitask here.
Absolutely.
So good afternoon, everyone. So as far as the COVID numbers go, hopefully you are all able to access our dashboard and have been monitoring. And then also we provide updates to the Board of Supervisors. So hopefully you're able to check in on those updates. But in general, what we're seeing is we've hit over 150,000 cases total and over 2,000 deaths. The good news is that our numbers are all trending down now. We're averaging about 250 cases per day. And that's come down quite a bit from, I think at one point we got up to over 500 a day. And then the case rate also has dropped to 15.9. So all those are good. And then as far as the hospitalization, sorry, let me pull that up again. We have dropped to 232 cases and ICU 58. So again, we're seeing a reduction there, almost 50% reduction. And in talking with the hospitals, I think they're also seeing a little bit of reprieve, but they usually are still pretty full because of other emergencies that come in. And one of the areas that they have a lot of concern about is with the behavioral health holds. So that's what they're dealing with right now. And also, of course, talking about the wall times as well. Major developments recently, the governor on Friday issued a new, actually announced that California was going to issue a new mandate for vaccination for children. This will be contingent upon full approval of the vaccine for children, and that will be all grades, but it will be in phases depending on when the full approval occurs. We anticipate that the earliest that this will go into effect is January 1st, but it seems with all the timelines that it's more likely to occur July 1st. There are some school districts that have gone ahead and issued their own mandates, such as LA Unified School District, and there are a few others in the Bay Area, but I can't remember which ones they are. And then the other that we've had some concern about is with the other state mandates for vaccination for healthcare workers. The deadline was October 1st. And so there was some concern with shortage in staffing if people either chose to quit their jobs or there was a delay in them meeting the guidance. It seems like, at least for the larger health systems, the compliance has been pretty good. There might be some people who are still waiting to get their second dose, but my understanding is that the compliance is in the 90s. So that is good. And so, but of course, because of, the hospitals are still experiencing quite a huge flow of patients. Some of them have continued to request assistance from the state for staffing. So that's it. One other thing that I've been asked about quite a bit is Sacramento County does have a masking mandate. for indoors for both vaccinated and unvaccinated. And there are a few other counties also that have mandates. A couple of weeks ago, the supervisors asked me when we anticipate that we will end that mandate. Basically, if we end the local mandate, then it will revert back to the state mandate, which is for unvaccinated, they still have to wear masks indoors. And what I told them is that we anticipate it will be when we get to a case rate of about 5 per 100,000. So as I mentioned, we're at 15 point something right now. So still have a little bit of time to go before we can hit that target. And so we'll continue to update on that. And I think that's the main point. So I see, well, actually, let me turn it back to you, Farla.
Okay, thank you for the update. Are there any questions? I'm glad to see.
It looks like Phil's hands up, Farla.
Okay, thank you. Doesn't show up very well here. Phil, your hand's up.
Hey, thanks for the update, Dr. Cosserier. So I had a question about some of the rapid testing. And I know, the turnaround time for the tests that are available to the public is, 36 hours or so. And I know elsewhere there have been really, really good success with kind of widely available rapid antigen tests that have really, really high sensitivity. And I'm just curious if there are bottlenecks for us kind of implementing those to make them more readily available in the county, or kind of what the roadblocks are on that front.
We are using the Binax Now kits. Those are the rapid antigen kits, but there is a national shortage. So we have had to prioritize schools. We, from time to time, have gotten additional allocations from the state. And so we are using them at many of our community testing sites as well. There are others that are available at pharmacies. The at-home test kits, I think there's some limitations to places where they are accepted. Because, for example, if you're going for travel, international travel, those are not accepted. So I think people are still having to look for testing at one of the pharmacies or healthcare systems. But my understanding is antigen tests are widely available here in Sacramento as well, apart from, of course, the shortage with the Binax Now kits.
Sure. Awesome. Thanks for the update.
And Phil, just to add on that, all of our community testing sites, except for one, which is at Branch Center Road, offer antigen test kits. So I can add the list into the chat, but there isn't any issues with that at this time.
Very helpful to know. Thanks.
I see a question in the chat. Any predictions regarding the flu season? Not at this time. We are hoping that we will get another mild season, but there's no guarantee, because last year, because of the social distancing and stay at home, we hardly had any flu cases. But this time around, the only measure that we have, apart from the vaccination, is the masking. So, of course, we know the masks do help as well, but I don't really have any prediction on what kind of a flu season we'll have. Usually we wait for the CDC to provide information from us, especially as they monitor what's happening in Asia, because their flu season starts earlier than ours.
Thank you very much for that. Thank you for the update, Dr. Cosserier. So now we have the pleasure of the attendance of Siobhan Kothari, who is the new Director of Health Services. It's a pleasure and an honor to have you join. And I'm sure everybody's looking forward to hearing all the exciting things that are going on since your arrival. So I'll turn it over to you.
Great, thank you so much. And apologies, I couldn't jump on right at 12. As we all are, we juggle multiple meetings. So appreciate you having me though and carving out some time on your agenda. I had an opportunity to actually have a one-on-one with Farla, which was really helpful and informative to learn about some of the FAB's priorities and concerns and the items that you've been discussing in your team. I also got to see your budget priorities. So thank you for spending some time doing that. That's very helpful to informing our board and our administration about what some of the community advisory board's priorities are, so that as they develop the budget and look at the ARPA funding, we can make sure that we're addressing the needs that are most critical. So one of the things that Farla asked me to talk about today was just some of those things that I've been seeing as I've spent now, it's been a little over 5 months here in Sacramento County. So the things that are coming up to my attention and that I'm seeing as priorities. And so I don't think anything that I'm going to share with you is going to be shocking, because as I look over your priorities, I think that we're very much aligned in terms of what we're seeing, but I will go over some of these, and I didn't put them into order of most importance, but I think you'll kind of get a theme here. And first and foremost, the most immediate needs, and Dr. Kassirier, I'm sure, has lifted this up, is just managing the demands of COVID on our workforce in the Department of Health Services, not only in public health, but our behavioral health, substance use disorder, and healthcare services, primary health services. What we've seen is that COVID has had a significant impact on the way we deliver services and on our ability to hire and retain staff and a workforce to meet the challenges. We do have vacancies in our department right now, and the difficulty in hiring and keeping up with the demands, it has been a challenge. And we're not only seeing that in Sacramento, but across the state. As you know, we're needing to really look at how we train our next generation of professionals and paraprofessionals and peers to be able to meet the demands of our fields. And so that is something that we've been working alongside the state in, really looking for how do we invest in building a pipeline of folks who can come into our field, and building those career ladders, so that even when folks are with us, there's opportunities for them to train and to continue to grow in their professional advancement, so that they do want to stay with us. So that's one of our challenges moving forward that we're looking at. Also, just the funding sources. One of the things that we've been advocating for, and will continue to ask for your advocacy at the state and federal level, is to move away from some of the categorical funding and ensure that we have flexibility of funding so we can be responsive to community needs. The way funding flows often really does box us in to doing things that sometimes don't always make sense, and more importantly, even when they make sense, if they don't braid nicely with other services, they become very difficult and challenging to get resources out into our communities quickly. So we'll continue to advocate on that front. Social determinants of health is also a really big area for us in public health, as well as behavioral and primary health. We want to make sure that whenever we're responding to the health or behavioral health needs of the community, we're really linking folks to the necessary services, income, housing, food, transportation, those types of things that really make a difference in their overall health. And so to the extent that we continue to partner with our other community partners and groups to make sure that we're effectively linking people, that's another area for us. And that really ties hand in hand with health equity and making sure that the resources that we do have get out to the most vulnerable populations who need them. In order to do that work, though, we need to have really good data systems and ensure that we're really looking at, from an epidemiological perspective, the data that's coming into us, so that we can ensure that we're targeting those resources effectively. And so, for instance, one of the things that you'll hear about is we're looking at how do we create what we're calling social health information exchange but a data system that ties together all of our electronic health records, not only from the county systems, but also from our private providers and partners. How do we tie in homeless and housing systems, overlay that with our eligibility systems for Medi-Cal or for CalFresh or those other types of social services, so that we can have a really good picture, not only on an individual and how to do the best possible care coordination for them, but also on a community level and looking at population health, which will be so important going into the future. I also often talk about an every door is a right door approach. And that what I mean by that is really that seamless linkage behind the scenes. We already have what I'll call a pretty fragmented system. We have lots of great services in Sacramento in the on the healthcare side, the behavioral healthcare side, and also our social service providers. But sometimes we tend to operate in silos. And once again, I think that goes back to funding oftentimes. I think it goes back to workload and everyone's just moving so quickly. But to the folks that we serve, that fragmentation can also lead to a sense of overwhelming, a sense of being overwhelmed and maybe not accessing the services in the best way possible. So it's incumbent on us as providers to make sure that we're seamlessly linking behind the scenes. We've been looking a lot at our behavioral health continuum of care as well. We know that there's some real pain points in our system. We know, for instance, that the hospital emergency departments are currently really impacted. We know that there's folks who need to move out of acute care, psychiatric care, and into step downs or into subacute care, but we don't have enough beds. We know that if we don't get folks into transitional housing or permanent supportive housing and they end up back on the street, we're going to see them back in crisis. We're going to see them back in our emergency departments. And that's what I mean when I say we need to look at all pain points in that continuum of care and how we need to build that out. The state's looking at this on a macro scale for the state through the use of the RAND Corporation, through the use of our partners with CalMesa, but we in Sacramento County and the region are also doing a deeper dive into our region and what we can do to actually identify which points in the continuum we need to focus on and where we need to build out. So that's another high priority for us. As you all know, we're under the Mays consent decree as well, but aside from the decree, the need for us to really look at the medical care, the substance use disorder care, as well as the behavioral health care for folks who are incarcerated, whether they be youth or adults, not only while they're incarcerated, but also as they move out back into the community, making sure that we have those seamless linkages to prevent recidivism and prevent them from relapse or going back into the system. And then I just wanted to also raise up our work that we're doing with the Health Authority Commission, which was recently codified by SB 226, a piece of legislation that codified that. The Health Authority Commission's role is to really ensure that folks who are receiving medical services through the Medi-Cal program have access to services, have quality services, and that we reduce the fragmentation as much as possible. That's the work of the Health Authority Commission. Department of Healthcare Services is currently going through a managed care procurement, as you may know, to reduce plans in our geographic managed care plan model from 5 plans to some amount that's lesser than that. They're signaling 2 or 3 at this point. The Health Authority Commission is not only watching that process closely, but also will be making recommendations to the Board of Supervisors about which plans to recommend move forward in that procurement process with DHCS. And so those are just a few of the things I wanted to lift up as being, you know, some of the work that the department's doing and some of our highest priorities right now. But I am happy to take any questions at this point. Thanks.
Okay, I open it up. Any questions from the board or other attendees?
Or feedback or comments. If you think that there's something I missed that we need to be focusing on, I really would love to hear that as well.
So now I see your hand up, and then Steve as well afterward.
Thank you so much for sharing. It was very exciting to hear about some of the priorities that Sac County is looking at, especially for me with behavioral health continuum. I just had two questions. One, you mentioned data systems. Curious to hear a little bit more about what you mean by that. Is it like an infrastructure need? Is it a need for increased data collection? Just trying to better understand what that means when you say data systems.
Yeah, no, thanks. That's a really good question. So somebody described to me that building a health information exchange was more of a verb than it was a noun. So I really liked that, because as I see the price tags that often go along with this type of work of integrating data systems, I think a lot of that, some of that is infrastructure, absolutely. It's about a system. A lot of it's the work that we do as community partners, the agreements that we put in place, the sort of legal hurdles and challenges we have around HIPAA, around CFR 42, navigating relationships and trust building, and then engaging with the folks that we serve first and foremost to make sure that they're informed and they're getting consent and see the benefit of us sharing information on their behalf to be able to serve them better. So a lot of the work that goes on to build this health information exchange is about the people power, the meetings, the relationships that are involved in that. We have lifted up a request through ARPA funding to actually build a social health information exchange. We're looking at Alameda County as one of the models that we might want to follow in their footsteps, because they've built a model that really has worked for them. And we already have a lot of our data systems that are connecting right now for reporting purposes through a platform called Care Quality. But what we want to make sure we can do is more real-time care coordination. So if my patient shows up in the emergency department, for instance, I can pull up a record to show all of the other services, who are their providers, and how do I wrap services around them in a meaningful way to get them quickly linked back to their provider. So I hope that answered your question.
No, that's really helpful. Thank you. I guess just a quick follow-up question, and then I can hand it off to Steve and come back later. To what degree will this platform potentially interact? I guess, there's sort of this Medi-Cal, and then there's hospital records and emergency records. And then as individuals go sort of in and out of Sacramento County, is there sort of that level of interaction, or is that something that, the county is going to try and build on, just trying to better understand sort of where you're at and where are we hoping to go?
Yeah, no, I mean, that's the goal, right? And certainly a lot of counties have been really successful in doing this. Often the counties that are more successful have fewer healthcare systems, fewer plans, maybe a county organized health system paired with maybe one or two major hospital systems or a county run hospital. We will have a bigger challenge here in Sacramento with our 5 plans and our 5 major healthcare systems, our 7 FQHC systems. I think there's going to be a bigger hurdle for us to get over. But yes, ultimately what you're saying is accurate, is to the extent that we can share records. And obviously there will always be firewalls. It's a need to know basis, right? What information do we need to share to get services for folks? We don't need to share everything. But I will say also, in addition to the benefits of looking at outcomes and evaluation and how is this individual different as a result of all of our systems supporting and working and providing care, there's also an issue of trauma-informed care that's really important, where if I'm accessing services, I'm probably not well, I'm probably vulnerable in so many ways. And the more times I have to tell my story, the more the less likely I will probably be to follow up with care because I am being re-traumatized every time. And so that's the other major point of this system is we've all experienced it, right? Going to the doctor and filling out that same form how many times when we go to different services. And if we had the option of saying, hey, just share my information, we may choose to do that. So yeah.
Thank you. No, that's wonderful. And it's really wonderful to hear that that's being taken into consideration. I appreciate that. Farla, I'll come back with another question later.
Okay. All right, Steve, on to you.
Hi, as a former PHAB member and as a longtime community member, let me just say that I'm very excited to hear the focus that you bring to this work. I know the county has recently gone through its big budgetary process, and I'm just wondering how you feel at this point about the level of funding for the Department of Health Services. And then just as an extension of that, maybe you could tell us a bit about funding for some of the smaller projects like WIC and Healthy Partners, for example.
Yeah, and I certainly, I don't know if Dr. Kasirier had to jump off, but it looks like she did. Okay, no, she's still here.
No, I'm on.
Okay, great. I'll start and then I certainly would welcome her to add. You know, I feel like we're in an interesting time and I don't know that I have enough data to fully answer your question other than to say, there's been a recognition by the Board of Supervisors that the work that we do in our department is very important from both a health and behavioral health perspective at this point. I think the pandemic has actually done a lot to shine a light on the importance of public health in our community and that work. And I'm really hopeful that going forward, there's a higher recognition federally, statewide, but also locally on the need not only to respond in a budgetary way to these crises, but really to start to put that infrastructure in place so that as we move forward, we can pivot easier and respond to the crises and get out in front of some of these other public health emergencies and crises. So climate change, for instance, is one of those things that I know the county's about to consider a climate action plan, for instance. Public health has a very important role in that, for instance. And so I would just say that I think that there has been definitely some attention. I think that the work that we have to do as a department to continue to provide the data and to lift up the issues to ensure that it stays front and center will be really important going forward. And certainly I see Sandy and Dr. Kasirier and Lori on the call. I would just ask any of my team if they wanted to add to what I said. They have a little bit more history than I do with the department. A lot more.
I agree with what you've said, that we need to continue just lifting up the importance of the projects. And of course, there are a lot of priorities. So being able to keep an eye on some of the ones that you've noticed, because they are small, they tend to be overlooked sometimes. And so I know recently we did have to advocate for, and of course, Sandy can talk more about this, for the WIC program. So we'll definitely continue to do that. And we appreciate the support from the Public Health Advisory Board, because several times we have come to you with some of our concerns and you've been able to lift those up to the Board of Supervisors. So I think that will continue.
Yeah, this is Sandy. Hi, thank you. I do agree with what Siobhan said and Dr. Kasiri. Some of our big efforts right now are getting funded, like COVID and public health, which is long overdue. Other programs, the smaller programs, it's a much harder road to get those funds. And so we do come to you with those and do appreciate your support immensely.
Thank you.
Lori, did you want to mention anything else? I saw your.
Yeah, I just agree with all of you that, you know, there's a lot of competing priorities, but we don't want to lose sight of the smaller initiatives and work that needs to be funded long term. But I know that you have open ears and very supportive and have had strong advocacy about gaps in both the mental health side and the substance use side. So appreciate that.
Thanks.
Okay.
And I'll just mention, I see a question about pharmacies and integrating that. So Steve, I might reach out to you. I didn't know you were, you had worked on this prior, so I might reach out to you for some more information on that. Thanks.
Yeah. So I guess you'll take that off, offline, in other words. Okay, so we have another hand up. Ashley, would you like to ask?
Yes, I wanted to ask about the pipeline. You mentioned about the workforce and what strategies you may be using to get people, and or just curious about job satisfaction, or, you know, is it vaccine hesitancy? Just curious about what could be the hurdles to get more people. I see the shortages on my side, so I'm just wondering what you guys are doing and how we're encouraging, you know, more people to join in and help, especially with COVID, the challenges that we are facing right now.
No, thank you. That's a great question. And I'm going to start, and then once again, my team can certainly add. You know, one of the things we've recognized is that we often aren't competitive when it comes to what we can pay people. And not just county employees, but the rates that we pay to our providers sometimes and our contractors. And so there's been a lot of work on that front that our team's done to really assess how is it that we can bring up rates, how is it that we can look at pay to be able to be more competitive in that space. So that's one sort of low-hanging fruit area. It's a big lift, but it's easy to recognize, right? I think the other thing is working with the universities to really determine how to encourage more folks to enter our field. And whether it's behavioral health or primary health or public health, I think we need a greater pipeline for folks being interested in coming into these fields in general. One of the things we've discovered in the behavioral health space is that we really need to rely on folks with lived experience and peers to do a lot of the work that sometimes when we hold out for somebody who's licensed and been in the field for a long time, we can't fill all of our positions, but peers can do a great deal of good and a great deal of services. And so the state's recently acknowledged that, and they're developing their peer certification program. And so we plan to take full advantage of looking at folks who are more non-traditional, if you will, in terms of how they provide services. The other way that I think the pandemic has really shown us, and the public health team has really worked with a lot of the community-based organizations that are already tied to the communities that we want to reach out to and serve, so that it's not reliant on the public health professionals doing the work, but it really looks at kind of that promotorist model, folks who are already embedded in the fields, friends, family members, so that we can give them a certain level of training to help us get information and access to services out there. Additionally, from a job satisfaction perspective, that is one thing that I've been pretty excited about our new CEO, Ann Edwards. She really is looking at climate and culture when it comes to organizations and the organizational health of the county. And it's something that we are looking at across the board, not just countywide, but in our department as well, to see what changes do we want to implement to make us an employer of choice, if you will. We've heard those words for a long time. We just are doing a deeper dive to figure out what's going to improve job satisfaction overall, not only in our field, but in our department as well. And I will ask my team if you have anything else you want to add to the workforce sort of pipeline question.
I think one of the things that Siobhan touched on, I agree with everything she said so far, is that, for example, in the jails, we've had an extreme shortage of physicians. And so we've just done that market survey and renegotiated that contract, and it will still probably take us 4 to 6 months to get the physicians up there. We also had to increase the registry contracts for physicians. Nursing, we're way below market, and we're entering into these labor negotiations with them, but that's only just starting, so we have to go through that process as well. It's really all over though. It's not just the county service. In the meeting with hospital CEOs, they are struggling with staffing. They have travelers nurses in the EDs. So we have stiff competition that we can't necessarily compete with hospital systems, local jails and prisons, other places. This began happening post ACA and it's gotten worse during the COVID because there is such a huge, huge hiring demand across board for healthcare staff. For programs like WIC, they do some innovative things and they're looking at more paraprofessionals for like nutrition assistants and really get a lot of enthusiasm from volunteers who they groom and train and coach and then lift them up into on-call employees or permanent. So they have a really super training program. So I think it really depends on the program and what kind of employees they need.
Well, I want to thank you, Siobhan, and the rest of the county members who chimed in here. This was incredibly informative for PHAB and appreciated, absolutely appreciated. Really good to hear all of these wonderful changes, plans, pursuits that will be ongoing to make this county the best it can be. So glad you're at the helm. Thank you so much and look forward to your future participation in our meetings. You're always welcome.
Great,
So
thank you so much. Thanks for having me.
Yeah, our pleasure. If there are any other questions, you can put them in the chat and we'll see if we can get them answered at another time. But we're going to move on right now to Dr. Damiano's update.
All right, thank you. And I didn't get my notes done in time, but I will send those today to you, Farla, and to Liz. We had talked about WIC, so I wanted to mention that our 2021 WIC report came out. So I will send that to everyone. It's an excellent report. I think you'll find some really, really good updates in there. And it really showcases some of the work they've done this past year during the pandemic time. So we'll send that afterwards. For emergency medical services, the 3 new positions that the staff were awarded, they filled those already. So they're very excited to add those team members onto the slot. And our team has gone from 7 FTEs to 10. So still a tiny team, but very thrilled to have those positions. As Siobhan mentioned, we have been working with stakeholder groups on what we call ambulance patient offload times, or what's known as wall times. That's when the ambulances are at the emergency departments, local emergency departments, and the hospitals have not assumed care for them. So during the COVID surge, which was really super high in August, we had pretty excessive wall times throughout the county, which means that there are less rigs available to respond to emergencies. So we have been meeting with hospital CEOs and with the fire chiefs and with county EMS. In fact, we have another meeting tomorrow. And we are working on trying to look at some items that will help improve those wall times. We have a couple of policies that we're working on, assess and refer, and another one for extended wall times that we're trying to do. In addition, we have stakeholder groups that are part of our emergency advisory group, and we are looking at possibility of these new community paramedicine program regulations that may come out or when they're approved, which I think will be 2021. Which will allow us to assess, treat, and transport to an alternative destination. And that's really exciting because the medics have to transport to local emergency departments. But we'll need to make sure that we have appropriate alternative destinations, sobering center, crisis residential, these kinds of programs. So we're in conversations about assess and refer policies and about alternative destination policy. So it's major work because our hospital systems are very impacted, our emergency departments, as well as our ambulance providers, both private providers, but mainly fire that responds to the 911 calls. So a lot of work in that arena. And then I wanted to give you COVID a report. I know you're interested in that. And we're very happy that the numbers are coming down, as Dr. Kassiri said, because once those transmission numbers go down, that's what we see. So for juvenile correctional health, still very tiny. As of last week, they had 54 confirmed cases throughout the pandemic. They did 46 tests last week, had one positive case. Their census is small. It was a 101. They vaccinated about 72 youth to date. For adult correctional health, much bigger. We've done over 22,000 tests throughout the pandemic. We're still testing 300. We did 349 last week, so it's still pretty robust testing on a weekly basis. Our number of confirmed cases has gone down. We only had a net increase of 5 last week, 5 cases. And for the snapshot in the jail, we had 6 confirmed cases in the main jail. Those are all in confirmed COVID housing, and none at the branch jail. So we can see those numbers starting to go down. For vaccinations, we've vaccinated a total of 2,262 inmates, and we have fully vaccinated 1,907 of those folks. When we looked at a snapshot in time, that picture looks quite different. We did a snapshot in time of September 15th, and so there were only 924 in custody because we have such a high churn rate. No matter how many we vaccinate, they revaccinate and they leave. But we looked at that snapshot because we wanted to see how long they've been in custody, and about 79% of those who were vaccinated had been in custody for 61 days or more, which is a good sign. We are getting those that have been in custody vaccinated. We are still offering all 3 types of vaccines to inmates and to any staff that want it. We are in the process of trying to be compliant with the state public health order for correctional facilities, which requires full compliance by October 14th. That is mandatory vaccinations. And if you don't have mandatory vaccination, you must have a medical or religious exemption and weekly testing. So that requirement must be fulfilled by the 14th. So we have rolled out a new system, and public health has been testing for us because we don't have the bandwidth to do all the testing for the custody staff. That testing has been in process since the beginning of September. So those are weekly clinics offered twice weekly at each jail facility, and it's mostly custody. So I will have the numbers. Right now, we're still having some difficulty with our data, that our vaccine verification system, but we believe our percentage on the health side is very high percentage of vaccinated staff for both health staff and for mental health staff. So I think we've been pretty consumed with that process. Does anybody have any questions for me?
Sounds incredibly consuming.
I'll send it to you. Okay, the data.
Thank you so much. Okay, so I'd like to move to thank you for the update. It sounds like there's a lot of progress there. Just uplifting in a sense. So I'm going to move to our next agenda item, which is an update from the PHAB Working Committee on Jail Health. And this dovetails into some of what Sandy brought up. And I'll look to Phil to give us a presentation on that.
Hi, everybody. I had Liz, do we have the Google Doc with the slides available? Perfect. Thank you so much. Awesome. Well, I will try and be relatively brief on the presentation, but I just wanted to provide everybody kind of an overview and an introduction to the Jail Health Committee that PHAB has formed. Next slide. So we will talk a little bit about the inspiration for this committee, kind of the structure of the committee, activities we've done so far, some of the findings initially, and some next steps that we have planned. And we can have a little discussion kind of towards the end if there's any questions or anything. Next slide. So the inspiration for this committee, as you all know, as we just received, we get frequent updates from Dr. Damiano, who has taken over the leadership of adult correctional health and has been implementing numerous changes there and navigating an infinite number of challenges in the process. And so we, stay abreast on a lot of those going-ons. And then last winter, there was kind of a COVID outbreak at the jails after many months of very low case rates. And so that kind of drew some of our attention as PHAB. And then as of, there are, in custody deaths that occur from time to time. Most recently, there was an in custody death on September 22nd that is still under investigation. And so anytime these happen, those always draw concern, and there's often not a lot of, at least immediately, not a lot of publicly available information. And so those drew some concern among our group. And then if many of you remember, I think last January, we had a lot of conversations around the federal CARES Act money. And there were a lot of concern among the public and among our county leadership regarding how this money was allocated. And there was a lack of transparency and a lot of frustration around that, as a lot of the money ended up going towards the sheriff's department and money that was promised to public health was not delivered to public health. And we don't need to go into all the details of that, but I think at the end of the day, there was a lot of concerns about lack of community engagement, lack of transparency around that. And so that kind of raised our concerns as well. And then the Mays consent decree, which we've discussed a little bit, is this lawsuit against our local jail system regarding concerns about ADA compliance, solitary confinement, or administrative segregation, out of cell time, mental health care, suicide prevention, medical care, and privacy or HIPAA compliance, physical space, and kind of in the context of these concerns about violations of the 8th Amendment. And so this is a super complex topic that most of us were not super familiar with, and something that the county is kind of actively engaged in addressing. So that was another issue that came up. And then many of you will remember last summer, we had a special PHAB meeting where we had information sharing from the Sheriff's Department, from Adult Correctional Health, as well as from Decarcerate Sacramento, and multiple community members who are directly impacted by incarceration. And kind of the outcome of that meeting, very briefly, in my mind at least, was there was a pretty broad divergence between the perspectives on the current conditions in the jail among the officials administering the healthcare and custodial care in the jail, and those community members who have direct contact, who are directly impacted themselves by incarceration. And I think, from a public health and a health equity lens, it's really important to make sure that we lift up the voices of kind of those that are the most vulnerable in situations like this. And so we wanted to embark on some more data collection so that we could better understand the situation at hand. Next slide. So the structure of the committee aligned with PHAB rules and Brown Act compliance. We have a working committee, maximum of 9 members, the majority of which have to be PHAB. So we currently have 4 PHAB seats. Myself and Libby Abbott are co-chairs of our committee. Ashley Sterling, without a G, that was a typo on my part, and Farla Kaufman are also members on this. We do have room for 1 more, so if anyone is interested in joining these efforts, we would greatly appreciate that, so we can have a full committee. And then we have another typo on my part, 3 community seats filled. 2 community members, JL Barnes and Liz Blum, both of which have immense knowledge and expertise and passion in this space. And they have contributed greatly to our work so far. And then the infamous Steve Orkand has also been lending his expertise and institutional knowledge and guiding us through this process as well. And then Lynn Berkeley Baskin is another community advocate who has a lot of expertise in this space. And she has been contributing greatly to our efforts so far as well in kind of an unofficial capacity, as all these meetings are open to the public. So anyway, anybody who wants to contribute, please reach out and we can plug you in. Next slide. So our activities so far, so we have reviewed multiple reports in various capacities. So the Disability Rights California is a group that has done a bunch of research in this space, specifically in Sacramento County. We reviewed their reports. The Vera Institute reports is another advocacy organization that has done research in this space. The reports that have been published so far from the court-appointed experts regarding the Mays consent decree, and then the OIG, or Office of the Inspector General, publishes an annual report. And we reviewed this last year's report. It is very dense, but we kind of went through that in as great a detail as we could. And then we've conducted multiple interviews so far and are kind of continuing to do so. Initially, we had a very long conversation with Dr. Damiano and County Counsel Rick Heyer to get some of the background on the Mays consent decree, kind of where the county is at in terms of compliance and what the oversight mechanisms look like, and kind of all the complexities at hand, and kind of what some of their concerns are and what some of the progress they've been making and their kind of future plans. And they were super helpful and generous with their time and answering all of our questions. We also met with the prison law office and some of the attorneys that were involved with the actual Mays consent decree lawsuit to kind of understand their perspective on kind of the grounds for the lawsuit to begin with, and then also kind of where the county is at currently in terms of compliance and what the oversight mechanisms are. And then we have so far had conversations with supervisors Cerna, Kennedy, and Tolley, and kind of, again, shared some of our concerns and then some of our plans, and kind of understood what their perspectives are on the issues at hand, and kind of what the directions are going forward, and what they need from us, and what would be helpful as we navigate this as a county. Next slide. And so findings, and this is going to be kind of a very brief version of this, and anybody is welcome to chime in on this, but COVID, a lot of these concerns came up, and I think a lot of cracks in our system were identified by the COVID pandemic in general, and this is obviously the case in the jail as well. So we had a lot of concerns very early on in the pandemic, especially in the wake of that initial outbreak that we had. And since then, at the report we just heard, there's currently much more robust testing and screening and quarantining procedures in place. And the vaccine uptake has improved greatly in the past few months, as the update we just got, and I look forward to reviewing report once we get that from Dr. Damiano. And then initially there were a lot of reports in the inside about, especially the Sheriff's Department staff and masking compliance, and then the limitations in physical distancing and confined spaces and access to hygiene supplies and stuff like that. And there have been reported improvements on those fronts as well. So just want to acknowledge those. And then in terms of the consent decree compliance, I think overall, the summary that we've kind of walked away with is the compliance has been pretty slow and limited in a lot of spaces. And I think there are numerous violations that still exist, unfortunately. I think the jails remain pretty overcrowded. There hasn't been a significant sustained reduction in jail population. And there's reported continued kind of overuse of solitary confinement relative to other facilities kind of across the country and across the state. And then as we mentioned in multiple of these previous presentations today, mental health and medical health services remain severely understaffed, despite the best efforts of Dr. Damiano and her staff. And so that remains an issue. And then there was a plan discussed to kind of expand the physical space of the downtown jail, and the county had voted not to proceed with the contractors that were kind of moving that forward. And the idea behind that was hopefully that would be a pivot towards jail population reduction. But concrete plans are still kind of up in the air on that. And I think overall, there are kind of significant oversight mechanisms in place regarding the consent decree compliance, but a lot of this data is not publicly accessible. And the actual reporting back to the Board of Supervisors regarding progress on the consent decree, I think from our perspective has not been super adequate. And so that's kind of something that we're hoping to address. And then also over the course of the summer, the Public Safety and Justice Agency was announced, and this is going to be a deputy CEO position that will oversee multiple departments within the county, including Public Defender's Office, probation, and several others. I'm drawing a blank right now, but not over adult correctional health. And then a component of this is also the development of an advisory committee that will apparently work alongside the PSJA. That's going to consist of hopefully some community impacted community members and other experts in this space to advise the Board of Supervisors and the Deputy CEO in their activities. And then we are hoping that there's going to be kind of the stated goal of this is to kind of facilitate some alternatives to incarceration and population reduction within the jail in order to comply with these elements of the consent decree, given that the current population levels, staffing levels, and space don't allow for compliance with the ADA and HIPAA, et cetera. And then next slide. So our next steps, future meetings we have planned. We have a meeting planned with the Inspector General, Mark Evanson. We are planning on circling back in the near future with Dr. Damiano, kind of once we complete the rest of these, to understand how we can align our efforts with the efforts that she's making towards compliance and towards improving healthcare within the jail. And then we have meetings planning to connect with Supervisor Frost, Supervisor Desmond, and circling back again with Supervisor Cerna. And then we're hoping to meet with the court-appointed experts in the near future, Madeline Lamar and Mary Perrion, to get kind of more information from them. And we're hoping to actually have a PHAB presentation with them at some point in the near future. And then hopefully we are going to be kind of compiling all of these findings and recommendations into a letter to the Board of Supervisors to help inform and advise them, as is our charge as PHAB. and kind of some of the components of this. And this is not an exhaustive list. Any of the committee members or other PHAB members, if you want to chime in here, feel free. But briefly, specifically on the PSJA, if there can be PHAB representation and ensuring that there is public health expertise that informs the activities of that board or that agency, and then advocating for some public hearings from the court-appointed experts and making sure that their findings are accessible and digestible to the public, as well as the public officials that are need to be making decisions based on their findings. And hopefully, like I mentioned, we'll be able to start with a PHAB presentation from these experts. And then kind of along those lines, making sure that there is the ability to review these compliance reports, possibly creating a dashboard of kind of the areas of the consent decree that are under compliance, those that are not yet in compliance, and kind of, or those that are kind of like in progress, and make recommendations based on those. And then additional data collection and making sure that as much data as possible is publicly available, so that we can kind of review different health metrics from the incarcerated population. And then this idea of potentially an exit survey for people who are incarcerated, so that we can kind of more directly understand their perspectives and their experiences of incarceration and the health and mental health services that they receive. And then regarding in custody deaths, making sure that there is monitoring and documentation, and then also benchmarking in custody deaths against other facilities within the state and across the nation to understand kind of where our county stacks up on that front. And then acknowledging also that there are kind of nationwide discrepancies in this, especially in terms of critically ill people who are transferred out of jail and then actually die at a health facility. This is something that I see in the emergency department not infrequently, where people get really sick and get brought to the emergency department. And when they die in the hospital, those are not actually counted as in custody deaths. Which kind of distorts the data if they became sick while in the jail. And then kind of along with the work of the PSJA, making sure that we're investing in diversion programs, additional mental health services, and other community supports that can potentially decrease the jail population and improve people's health outcomes. And then just generally, making sure that with all these findings, there is a sense of accountability, and figuring out how we can operationalize that and how we can best advise the board to ensure that accountability is upheld. So that's the presentation, especially the committee members right now. If there are other thoughts, other things I might have missed, I'd appreciate anybody chiming in, and then I want to make sure we have time for any questions from PHAB and from the public.
Okay, I see Steve Orkan's hand up.
Actually, that's not a hand up, it's an applause.
Oh, it's an applause. I'm sorry. Their tiles get too small on my screen.
Bill did a great job in reflecting our committee discussions, so sorry.
Yes. No, congratulations. Yes, that was very well done. Very comprehensive and understandable. Are there any questions in this regard to this matter? Public comments included? No. Okay. So I'm going to ask the board, is this pretty clear what PHAB's intent is through the working committee and their work? That we plan on sending a letter to the Board of Supervisors. We've been looking at this issue of correctional health, jail health for quite a while, and it's time we send a letter with our recommendations, because that's our job. So does anybody have any comments about what they think might be objectionable in any way? Do you endorse this letter? Are there any questions about what Phil presented in terms of content to include in the letter? Okay. I'm gonna take the no comment as everything's okay, copacetic, understandable. You see this as PHAB's position and responsibility to do. And the next step would be the letter to bring to, we were going to present a letter this meeting, but it wasn't quite time for, I felt that it was important for PHAB to understand and put the letter in context, that the backstory, all the work that the working committee has been doing, all their findings, and then with that understanding, bring to you the letter that will be drafted. So that will be on the agenda next meeting. It will be sent to you well in advance of the meeting. It has to be attached to the agenda. So, you know, at least hopefully a week before. And we can discuss it at the meeting. So bring your comments. All right. Liz?
Yeah, so I think just to make sure folks are clear on language, so you asked if there's any comments around content to include from the letter. Did you mean to say from the presentation?
Yes.
Okay.
Yeah, content to include in the letter from this presentation. Thank you.
Yeah.
No, okay. So we'll bring the letter to you and get comments and feedback, and we'll take a vote at the next meeting.
This is Sandy again. I just wanted to share for you, for people who aren't used to consent decrees, our youth detention facility at one point was under consent decree, I think for 7 to 10 years. And they just received national accreditation. So a lot of times these efforts are needed because facilities are understaffed, don't have the right elements, and it does take significant overhaul of those processes. And when you're fighting things like staffing and COVID, et cetera, it takes even longer. The state system is still in a federal receivership, which has been, I think, 28 or 29 years. We don't anticipate that for Sac County, but this is what happens with prisons and with jails nationwide. It does take significant efforts once you've been underfunded and you have a different culture and you're moving from one practice to another practice. So it is a long haul endeavor. So I do want to thank the PHAB subcommittee. And also to let you know, when people do die at a hospital, it does count as an in-custody death, by the way. So I don't know if that's true for every place, but I do know for our county jails, it is true.
Very, very good to know. Thanks for that.
Yeah, thanks for the clarification. That's important. Okay. Any other public comment? I'm seeing none.
Farla, I have public comment not related to that, but for other announcements, if we're at that point.
Sure,
in the agenda.
absolutely. Yeah.
Hi, everyone. Good afternoon. I'm Lori Miller, the Division Manager for Substance Use Prevention and Treatment with Sacramento County. So I wanted to provide a couple of updates to this board, as I know many of you have a interest in addiction medicine and the work that we're doing. So I wanted to provide a few things for you. And I did send some information to Liz to add to the minutes. But I wanted to let folks know that our Opioid Coalition is coming up on October 18th, and the focus will be on fentanyl. Fentanyl deaths, overdoses, and poisonings have been on the rise for the past 2 years, but the current coroner's office data is pretty alarming. In 2020, we had 88 overdose deaths or poisonings with young people, and then 54 within a 6 months period in 2021 from January to June. So very concerning around this. So we are partnering, Substance Use Prevention and Treatment is partnering with the DA's office on development of a campaign effort that will span about 2 years. And then we have an upcoming event, and I sent the flyer to Liz if she wants to share the screen or not, but you can have it in the notes. The event will be a fentanyl awareness safety fair occurring on November 6th, the north lawn of the state capitol from 11 to 2. And basically it's an event to raise awareness and provide education to the community, especially targeting our young people and families of young people, as we're seeing a rise in deaths of our youth population from ages 14 to 18. So this event, there will be some remarks made by Supervisor Desmond as it's in his district, by U.S. Attorney's Office, by District Attorney Schubert and Ryan Quist, our Behavioral Health Director. We will be giving out Narcan and providing Narcan demonstrations at this event, but lots of different resource tables, hoping to have about 30 at the event. So I really appreciate your support, and if you can send the flyer out to all of your networks and people that would be interested in this event.
Definitely. Thank you so much for that.
Yeah, and then I want to just talk a little bit about methamphetamine, since that's still plaguing our community and really a devastation around Sacramento County, but we continue to have our meth coalition. Our next meth coalition is November 4th. And we have another campaign that's out there. And again, I shared that with Liz, if she wants to share. We have some bus transit shelter ads going right now as part of our letstalkmeth.org campaign. Lots of resources on our new website, but we're hoping these shelter ads that are placed in about 30 locations across Sacramento will be helpful in trying to get people into the most needed care, since meth is still a significant issue in our community. So this is what the shelter ads look like if you see them out there. So I just wanted to make you all aware that meth and opioids still a big issue, but we're working hard through our coalition efforts to try to tackle it. I wanted to keep this board updated on a lot of our initiatives and work that we're doing.
And we very much appreciate that. And we'll try and publicize this as much as possible. I'm hoping to eventually have more information that we can put up on our website and get more traffic to help with that. But we will definitely circulate it to all parties that we can reach. Thank you. Those
Thank you for the time and the
very
support.
important.
Appreciate it.
Great to hear about these events and efforts. Okay, anybody else? Nope. All right, thank you so much. Good meeting, very productive, lots of positive information and activities that we can look forward to, and certainly the work of the working committee. So they will bring back a letter and we will see you next time.